Hello, everyone, and thank you for attending our question lab. This evening's topic is biochemistry, and leading tonight's discussion is Dr. Paras Fakhari, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went back home to Michigan to do medical school. I also am an RX coach with USMLE-Rx. What that means is I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach is our tutoring and coaching program. We'll talk more about that later this evening, but for the meantime, what I want you to know is that the methodology we will employ as we dissect these 4 questions on biochemistry is very similar to the approach that we use in our coaching sessions. So without any further ado, let's go ahead and get into our first question of the evening. As you can see, the answer choices have been removed. That is by design. We do that because we don't want you to be distracted by the answer choices. We don't want them to guide your thought process. And we don't want you to see an answer choice that you may be unfamiliar with and end up panicking as a result. We've removed those answer choices. Once we cover those up, we will go ahead and start with the lead-in. The lead-in is the last sentence of the question itself. And we do that so you know what the vignette is asking. This way, as you read the vignette, you can pick up on all those relevant clues and prevent yourself from having to waste time on test day. So let's go ahead and take a look at that lead-in now. The substrate of which of the following enzymes has likely accumulated in his lungs? The substrate of which of the following enzymes has likely accumulated in his lungs? After that, we'd like to ask our students how many steps they believe this question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. An example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require, and then we'll go ahead and move on to that vignette. All right, as the response is coming in, let's go ahead and take a look at that vignette. A 75-year-old man comes to the physician because of worsening shortness of breath and a chronic cough over the past 10 years. He has a 100-pack-year history of cigarette smoking. The substrate of which of the following enzymes has likely accumulated in his lungs? I want all of you to start thinking about the important and relevant clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So generally with questions, they often like to give us demographics to start off with. So in this case, a 75-year-old man. So it's important to make note of that because automatically that can start to clue you in on what may be going on in the question. It's always important to make note of that. Then they usually tell you, why are they coming to the hospital? Why are they coming to the ER? What are those signs and symptoms that brought them in? In this case, it's worsening shortness of breath and chronic cough. So you want to make note of that because that's what brought the patient in to be seen. Then they often tell you, how long has it been going on for? Has it been going on for a few minutes? Has it been going on for years? So you can get some degree of chronicity information from that first sentence. So they're telling us this has been going on for 10 years, so definitely a chronic issue, okay? Then you can see this is a much shorter question, talking about pack history and smoking. But we kind of already knew that this was more of a biochemical question as we read that lead-in. They were asking us about a substrate of an enzyme that has likely accumulated in the lungs of this patient, okay? So I think we've got a couple steps here. I think we've got to figure out what's going on with this patient. Step number 1. CO2, what substrate would have accumulated in the lungs of this patient? Step number 2. And then that substance, what enzyme is it a substrate for? So I think we've got 3 steps here. What's going on with the patient, what is accumulating in the lungs, and what enzyme is that substance a substrate for? So let's go ahead, let's take a look at those answer choices. And what we see here are 5 answer choices. And so when we go through answer choices, what we recommend is that students, that they start at the bottom and that they work their way up to the top. And the reason we recommend this is, sometimes we'll see students who they'll start at the top and they'll work their way down through those answer choices, but they'll see something they like and they'll select it without having gone through all the choices. So sometimes they'll get that question wrong. So we recommend starting at the bottom with answer choice E in this case and working your way up to answer choice A to help prevent yourself from making that mistake and prevent yourself from biasing yourself. So let's go ahead and let's do that now. Answer choice E, sodium, potassium, ATPase. D, sodium, proton exchanger. C, NADPH oxidase. B, cyclin-dependent kinases. And A, carbonic anhydrase. So we're going to go ahead and open up that poll. Go ahead and select the answer you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. The poll is open. We'll give all of you a few moments to respond. Once again, we're going to wait until about 2/3 of you have responded before moving on. Remember that there is no penalty for guessing on test day, and certainly not tonight. All of your submissions are anonymous. So take your best shot. And if you're unsure, take your best guess. And as always, we will review the correct and incorrect answer choices in a moment. All right. I see that over 2/3 of you have responded. Let's take a look and see what you selected. In first place with 44% was carbonic anhydrase. In second place, we had 29% of you select NADPH oxidase. So let's take a look and see what the correct answer is. And the correct answer is A, and 44% of you got it right. So great job. It was a tough question. Let's pay attention to Paras now so we can all get it right on test day. Paras.
Thank you, Sean. So let's go ahead and let's take a look at those answer choices one more time. Definitely a tough question here. So hopefully you guys picked up on this patient having a chronic cough and worsening shortness of breath with 100 pack year smoking. Now this patient likely has COPD, or chronic obstructive pulmonary disease, okay? The other thing is, so that's our first step, figuring out what this patient has, COPD. So now we've got to figure out what has likely accumulated in his lungs, okay? And that is probably carbon dioxide, CO2. In patients with COPD, they have air trapping, they have an issue with expiring or expiration, okay? So CO2 is accumulating in his lungs. So that's the substance that is accumulating. So now we've got to figure out what enzyme is CO2 a substrate for, okay? And CO2, if you guys remember, is a substrate for carbonic anhydrase, okay? It is an enzyme in a few areas, but especially red blood cells, that catalyzes a conversion of CO2 to bicarbonate. So let's take a look at the next slide, a little bit of a throwback to our RBC physiology. You can see there that CO2 gets converted via carbonic anhydrase to bicarbonate, okay? And so there it's clear to see that CO2 is a substrate for the enzyme of carbonic anhydrase, okay? And this is primarily how CO2 is transported from the tissues to the lungs, okay, to then be expired. So the majority of the blood CO2 is actually carried as bicarbonate, as you can see in step number 1. But it is formed from CO2 after conversion via carbonic anhydrase. Okay. So let's go back to our other answer choices in case you selected that. The sodium potassium ATPase, obviously, as you can imagine, the substrates would be sodium and potassium. Probably not what's going to be accumulating in COPD, sodium and potassium. Same thing with answer choice D, probably getting at a substrate of sodium and protons. Okay. Again, probably not what is accumulating in COPD patients. Lastly, answer choice C, NADPH oxidase. This is converting oxygen into oxygen radicals. So oxygen is the substrate for NADPH oxidase. And actually, in patients with COPD, we wouldn't expect oxygen to be accumulating. Lastly, answer choice B, cyclin-dependent kinases. These are important for the progression of cell cycle, and oftentimes they are unregulated in cancer, where they lose regulation of the cell cycle. So not really what's going on here with COPD. So the best answer choice here is answer choice A.
Well, thank you very much, Boris. Great job, everyone. Let's move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design. And we will begin with the lead-in. Which of the following molecules is most likely increased in the serum of this patient while taking this medication? Which of the following molecules is most likely increased in the serum of this patient while taking this medication? Once again, I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll move on to the lead-in. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. A 54-year-old man comes to the physician with worsening of his chronic osteoarthritis pain. He is taking an over-the-counter medication which, if overdosed, may cause combined metabolic acidosis and respiratory alkalosis. Which of the following molecules is most likely increased in the serum of this patient while taking this medication? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this question and vignette. So once again, starting off with demographics. Definitely want to make note of that. Automatically going to start cluing you into some things. This patient came in because of worsening osteoarthritis pain. That's chronic. They gave us some chronicity there as well. Okay. They then give us some information about this medication, that if you take too much of it, it can cause some metabolic issues and respiratory issues. Okay. So then they're asking us about a molecule that's most likely increased in the serum if you take this medication. So I think we've got a couple steps. I think one, we've got to figure out what is that over-the-counter medication. I think two, then we've got to know the mechanism of action of that medication. So we can then figure out step 3, which is what molecule or substance is going to be increased in the serum. So 1, what is that medication? 2, what is the mechanism of action of the medication? And 3, what are the substrates and substances and byproducts that may be increased in the serum as a result? So I think we've got a nice 3-step question here. So let's go ahead, let's take a look at the answer choices here. And once again, we have 5 answer choices. What we're going to do once again is we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, thromboxane A2. D, prostaglandin E2. C, prostaglandin D2. B, prostacyclin. And A, leukotriene B4. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you, Paros. Once again, the poll is open and we will wait until about 2/3 of you have responded. All right, a few more seconds here. Lock in those answers. All right, well, let's take a look and see what all of you selected. 41% of you selected leukotriene B4. Second place was tied with 19% for prostaglandin E2 and thromboxane A2. So let's take a look and see what the correct answer is. And the correct answer is A, leukotriene B4, and 41% of you got it right. So great job to those of you who did. But let's make sure we got it right for the right reasons. And if you didn't, don't worry. Pay attention to Paros. He's going to explain it to you now. Paros.
Thank you, Sean. So great job, guys, with this question. So what are we talking about here? What is that over-the-counter medication? Well, it is actually likely aspirin, okay? If you guys remember, aspirin, if overdosed, can cause both a combined respiratory alkalosis and metabolic acidosis. So how does it do that? Well, the metabolic acidosis is from lactic acidosis, okay? So we can get a metabolic acidosis from salicylates or aspirin. And salicylates or aspirin actually can cause hyperventilation. It stimulates the respiratory centers and can cause hyperventilation. So you can get a respiratory alkalosis on top of that, okay? So now how does aspirin work? What does it do? Well, let's take a look at the next slide. And we can see here, this is talking about the famous arachidonic acid pathways. And you can see they're kind of on the right side under that little bubble talking about COX-1 and COX-2 inhibitors. That aspirin is at the very top, and it is an irreversible cyclooxygenase or COX inhibitor. It is non-selective, so it inhibits both COX-1 and COX-2. Now, normally, cyclooxygenase works to convert arachidonic acid into prostaglandins, prostacyclin, and thromboxane. But if you're inhibiting COX or cyclooxygenase, well, then you're going to have a buildup of arachidonic acid. And instead, that arachidonic acid is going to go down the other pathway where it's metabolized by lipoxygenase. As a result, you're going to get more buildup of byproducts of that enzymatic pathway, which are leukotrienes. So in this question, because we are inhibiting cyclooxygenase irreversibly and non-selectively, we're going to get a buildup of arachidonic acid that is then going to somewhat get shunted down the other metabolic pathway that is going to lead to a buildup of leukotrienes. So leukotriene B4, which is the correct answer, which is also important for neutrophil chemotaxis, that is what would be elevated in this patient. If you look at the other answer choices are all on the right side of this table. Prostacyclin, prostaglandin D2, E2, thromboxane. So all of these are on the right side of that pathway. So you would actually have less of that in your blood. So if we go back to our question, hopefully, and look at the other answer choices, hopefully you can see that only one of those really was on the left side of that pathway. That's why leukotriene B4 is the best answer. All of the other answer choices are byproducts of the cyclooxygenase pathway, which is inhibited by aspirin. So those would be not as good answers here. So the best answer is A. So great job on this question.
Well, great job, everyone, and great job always, as Paris explains it really well. So hopefully you'll all get it right on test day. Speaking of explanations and Paris and our other coaches, we do have RX Coach, which is our coaching and tutoring program. We help you make a personalized study plan. So if you're currently in school studying for your block exams, we'll use your syllabus and learning objectives. If you're studying for a board exam, we'll give you one of our assessments and base your study plan on that. So one-on-one approach will help you identify and bridge your knowledge gaps, help you study more efficiently by taking the guesswork out of what you should be doing. And they'll work with you on your test taking skills to make sure that you have the foundation you need and you can apply it to excel on the exam and get that residency of your dreams. If you're interested in working with a coach like Boris or Brenda, please reach out to us at www.rx-coach.com. click on the free consultation tab to talk about the program and how it can benefit you. We've had a lot of success with our program. You met Brenda today, who was a coaching student and is now a coach. We are the only tutoring and coaching company that's created our own resources and been around for about 30 years. So we have a lot of data that we can use to help make sure that your process of studying is efficient and you maximize your potential on test day. Once again, that website is rx-coach or rx-coach.com. So with that, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up. We will begin with the lead-in. Which of the following enzymes is most likely deficient in this patient? Which of the following enzymes is most likely deficient in this patient? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And we'll move on to that vignette. All right, I see the responses coming in. Let's take a look at that vignette. A 6-month-old boy is brought to the office by his mother over concerns of developmental delay and foul-smelling wet diapers. Pregnancy and birth history are unremarkable. The baby and his mother immigrated to the United States from Russia 1 month ago. On physical examination, the patient has a social smile, but does not hold his head up on his own or make babbling noises. Brisk reflexes are noted in the upper and lower extremities. Skin examination is shown. Which of the following enzymes is most likely deficient in this patient? Boris.
Thank you, Sean. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we've got a much younger patient, a 6-month-old boy, okay? And we are told right off the bat of certain concerns that made the mom bring the baby in. Developmental delay and foul-smelling wet diapers, okay? They then give us some important social history. Anytime you have a patient and any time they talk about immigration or where they came from, always important to make note of that, okay? They also give us some important physical exam findings as well. Definitely important to take note of that, especially when they're abnormal. And then they show us an image of the skin for the 6-month-old boy, okay? So you want to take a look at that and kind of take note of maybe what you're appreciating in that image, okay? So then they ask us about an enzyme that is most likely deficient in this patient. So I think we've got a couple steps here. I think one, we've got to figure out what's going on with this baby, what's the condition, and then two, what is the deficient enzyme in that condition? So I think we've got a nice 2-step question here. So let's go ahead, take a look at those answer choices. And once again, we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, tyrosine hydroxylase. D, homogentisate oxidase. C, dopamine beta hydroxylase. B, dihydrobiopterin reductase. And A, branch chain alpha keto acid dehydrogenase. So once again, make sure you're taking a good look at that photo and the clues. We're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. Once again, we'll wait until about 2/3 of you have responded. All right. About 55% of you have sent in your responses. Just a couple more seconds here. All right, well, let's take a look and see what all of you selected. Once again, answer choice A at 41%. And the second and third place are pretty much tied at 19 and 18%. So let's take a look and see what the correct answer is. And the correct answer is B. And 18% of you got it right, so definitely a challenging question. Let me hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question here. So what exactly is going on? What's that first step? What's the diagnosis here? Well, this patient has some immigration history, Okay. This patient has developmental delay, foul smelling odor, and an eczematous rash. Okay, if you look at those cheeks, what you kind of see is this ill-defined erythematous, maybe somewhat scaly rash on the cheeks. And especially in infants, eczema is pretty common on the cheeks. And as we start to get older, it starts to move more on the extremities. But in newborns and infants, it's more common on the cheeks. Okay, so we have this eczematous rash and these other signs and symptoms. And these are concerning for PKU or phenylketonuria. Okay, and the reason they gave us this immigration history is because in the US, this is usually something that's discovered at birth when you do your routine newborn screening. So it probably would not have been missed had they been born in the US. However, since they immigrated here from a different country, it's possible it may have been missed. Okay, so let's take a look at the next slide, and it kind of looks at PKU or phenylketonuria. Okay, you can see there that it's caused by either a decrease in phenylalanine hydroxylase or BH4, tetrahydrobiopterin, which is a cofactor. Okay, so in that case, tyrosine becomes essential. It becomes an essential amino acid. And you can see there under the findings, you can get eczema, you can get foul smelling or musty body odor, intellectual disability, which could manifest as developmental delay. Okay, so this is all pointing towards PKU. Okay, and you can see there also on the right side that screening occurs a couple days after birth. Okay, so that probably would have been caught in countries that search for PKU in the newborn screening exam. And you can see there in that enzymatic pathway at the bottom, the role that BH4 plays as a cofactor in converting phenylalanine to tyrosine. And if you don't have that cofactor, how that could lead to that pathway not moving forward. So if we go back to our question and look at the other answer choices, well, hopefully those clues are now starting to fit. Okay. The other answer choices, tyrosine hydroxylase, that actually is deficient in oculocutaneous albinism. So you have patients who have areas of very light colored skin, light colored hair or white hair, and blue eyes. Answer choice D, homogentisate oxidase, that is the enzyme that is deficient in alkaptonuria. Okay, and what you get is essentially arthralgias, you get deposition in various areas, not what's going on here. Answer choice C, dopamine beta hydroxylase is involved in making norepinephrine and epinephrine. So if you were to have a deficiency in that enzyme, you would have low blood pressure, low blood sugar. Answer choice A, that is getting at maple syrup urine disease. Okay. And what you have is you have an inability to break down branch chain amino acids like leucine, isoleucine, valine. And so how those patients present is they present more within the first few days of life with irritability, vomiting, lethargy, and a maple syrup smell to the urine. Okay. So a little bit different, probably the closest answer choice, I think that was the second most common here as well. But the other clinical signs and symptoms did not really fit with that, as well as the age of presentation. So the best answer choice here is B after picking up that this was PKU. Definitely a tough question here.
Yes, it definitely was a tough question, but hopefully you paid attention to Paris and we'll get it right on test day. Let's move on now to our last question of the evening. Let's try to finish strong. Answer choices have been removed, and once again, we'll begin with that lead-in. An increase in which of the following characterizes the most likely diagnosis in this patient? An increase in which of the following characterizes the most likely diagnosis in this patient? I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. All right, I see some responses coming in. Let's read that vignette. A 17-year-old boy is brought to the office with fatigue, darkening urine, and a yellow tinge to his skin and eyes. His mother reports that symptoms began after he was started on sulfamethoxazole and trimethoprim 3 days ago for a urinary tract infection. Laboratory tests now show a blood hemoglobin concentration of 10. An increase in which of the following characterizes the most likely diagnosis in this patient? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette in the lead-in. And so now this is our fourth time doing that. So hopefully you guys are starting to pick up on what clues are, important to make note of. What are the things you don't want to miss? What do you want to highlight? And what should you be thinking about as you go through these questions? So you can really start to be as concise and pick up on those important clues. So once again, we are now told this is a 17-year-old boy, and he's coming in with some concerning signs and symptoms: fatigue, dark urine, and a yellow tinge to the skin and eyes. Okay. We're told a little bit of temporal history about when this started, what he was doing, what he took before that. We also get some one lab value as well. So you want to make note of that. You want to make note of the potential inciting event or precipitating event in this case. Okay. So then they're asking us about an increase in what would characterize the most likely diagnosis. So I think we've got a couple steps here. I think one, we've got to come up with that most likely diagnosis. And then two, what would be increased in that diagnosis? So I think we've got a nice two-step question here. So once again, let's go ahead, let's take a look at those answer choices. And we'll start at the bottom, we will work our way up to the top. Answer choice E, reduced NADPH. D, oxidized glutathione. C, oxidized NAD+. B, autoimmune IgM antibodies. And A, autoimmune IgG antibodies. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. This is our last question of the evening. Let's try to finish strong. All right, a few more seconds here. All right, let's take a look and see what all of you selected. And 47% of you selected oxidized glutathione. And in second place, we had oxidized NAD+. So let's take a look and see what the correct answer is. And the correct answer is indeed D, oxidized glutathione. 47% of you got it right. Our strongest showing of the evening. Great job, everyone. Let me hand it off to Paris.
Thank you, Sean. Yes, great job, guys. Way to end strong. So let's take a look at what's going on. So hopefully it seems like you guys picked up on this, but this patient is having some jaundice, fatigue, and dark urine after taking medication, specifically sulfamethoxazole and trimethoprim, which is a sulfa medication. So hopefully you guys picked up that this patient likely has G6PD deficiency or glucose 6-phosphate dehydrogenase deficiency. Let's take a look at the next slide, looking at what that deficiency means. So it's a hereditary disorder where your red blood cells are more susceptible to hemolysis, especially in the setting of oxidative stress. So sulfa drugs, fava beans, nitrofurantoin, primaquine, all drugs that can increase oxidative stress. So as a result, you can see there that that the red blood cells are more susceptible to oxidative stress, and that's because you have more oxidized glutathione. Okay. Normally, you have glutathione in a reduced state. Okay. What happens is during oxidative stress, that glutathione in a reduced state, when you have lowered levels of reduced glutathione, you're not able to break down those oxidative metabolites and those molecules that are causing oxidative stress. So because you have too much of oxidized glutathione, you're not able to take care of that oxidative stress. So what ends up happening is you end up having destruction or hemolysis of those red blood cells. So this is what's going on in G6PD. We take a look at the other answer choices, what could be going on there. With our other answer choices, answer choice E was reduced NADPH. This actually generally isn't really associated with a disease. It's needed for a lot of metabolic reactions, so actually not a bad thing. Too much oxidized NAD+ is also not usually associated with the specific disease. Autoimmune IgM antibodies, that could be talking about autoimmune hemolytic anemia, both answer choice B and answer choice A. You can have autoimmune hemolytic anemia where you have antibodies, whether IgM or IgG, that react against your red blood cells. Now, this can be idiopathic. It can be precipitated by certain drugs, usually penicillin or methyl-dopa. Those would be your two main culprits to remember, penicillin and methyl-dopa. You can also have certain conditions like lupus or leukemia, or even infections like Epstein-Barr virus infection that could also precipitate autoimmune hemolytic anemia. But again, not what's really going on in this question. We know there is a sulfa drug that is increasing that oxidative stress. So the best answer choice here would be step 1, knowing this is G6PD deficiency, and then 2, knowing that in this case we have low reduced glutathione and more oxidized glutathione. So way to end strong with this question. Definitely some nice biochemistry questions here today. Now I'll hand it back to you, Sean.
Well, thank you very much, Boris, and thanks to all of you for being here. These are the 4 questions that we did this evening. So if you want to make note of these question IDs, you can simply type these into the RX search field and pull them up and review them more on your own time. So I'll give you a few moments here to take a screenshot or jot these numbers down.